So today's topic is, can antibodies, I'm assuming for Hashimoto's, go away or go into remission? And it's a good question. I don't think it's a question where clarity has yet been reached in some of the definitions of going away or remission relative to antibodies. So let me just see if I can answer this question as I think that this person probably, the information that this person probably wants to know. So antibodies are confusing with Hashimoto's. I had a case just about 10 days ago, and they were telling me how their nurse practitioner was managing their case according to their antibodies, and it didn't seem to make sense because their symptoms were getting better, but her antibodies were getting worse. And that can happen. Okay. And so there's I would say autoimmune and immunology in this field is kind of in its infancy. And there's a lot of lack of understanding of what's going on, and more understanding is coming about day by day. But I can tell you what I know. Okay, what I know is that antibodies can go up and down irregardless of how you feel. And so if somebody has an antibody count, so that we use a range of 0 to 9. So if somebody, and if you're over 9, then in what's called thyroid peroxidase antibodies, then, and there are other ones, but I'm just going to use this one. Then we feel comfortable with saying that you have Hashimoto's. So then patients come in now who've already been tested, and they go, "Oh, I really got it. It's like, I got like my antibodies are like 700." Then I go through their exam. Then their thyroid's not swollen, and they're not losing their eyebrows, and they're not losing their hair, and so and then they haven't put on a lot of weight, and they're having very few symptoms, and so they're not having really a very active, aggressive case of Hashimoto's. I've had people who have come in here with measurements of antibodies in the 20 and 40 thousands and really not be that sick. I mean, they had some aspects of Hashimoto's. Maybe they got like heart palpitations occasionally for no reason at all. Maybe they had anxiety that they weren't connecting to the Hashimoto's. Maybe their hair was thinning or something like that. But not like full blown, oh my God, every joint pain, my bowels are bad, I'm depressed, I can't get up, I have so much fatigue. Nothing like that. These are people who had 20 and 40,000 counts on their thyroid peroxidase enzyme. And by the same token, myself, my very first test for me to determine that I had Hashimoto's was a 14. And I was like really, really sick. Since then, I've had numbers of 26, I've had numbers of 40, and I've had numbers of normal. I've gone and I've tested as normal. I do think that I do know that there are certain triggers that will make those antibodies go up and down. Gluten is one of them. If a person comes in here and they want to get tested for antibodies for their thyroid, and they've been off gluten for a year, I just tell them, I'm not even going to test you, because gluten has a connection to thyroid antibodies. It's called molecular mimicry, and if you eat the gluten, your stomach flares up from it, your intestines flare up from it more specifically, and then that will cause your thyroid antibodies to flare up. It may not cause you to be sick. It may cause your thyroid antibodies to flare up, but you may not get thyroid symptoms, or you may get full-blown thyroid symptoms. So, we've grown up in a world, or like I've grown up in a world where we've been told that we're like mechanical beings where we want the exact answer. And one of the big problems with these mystery diseases is there are so many areas where there are not exact answers, and this is one of them. So within that context, can thyroid antibodies go into remission? I think once you've made antibodies to your the way that your immune system works, when these B cells in your immune system make these antibodies, they're designed to make them every time you're poked or prodded. Your immune system is poked or prodded by that issue. So if it's a virus or a bacteria, you make the antibodies, and the antibodies are supposed to hang around in case that comes back, and then the antibodies are supposed to mount an attack, and then they're supposed to get rid of it. Okay. However, with autoimmune problems, those antibodies will flare and go down. Sometimes, like we just used the gluten example, they'll flare up. If you have Hashimoto's, some people's antibodies will just blow up when they eat salt. Others people's will not blow up when they eat salt. Some people's antibodies will blow up when they overtrain in exercising. Other people's will not. So it's a very complex system, which is not completely understood. But again, this is relative to the triggers that we talk about that will exacerbate your antibodies. Botox, get a Botox shot. It's been shown to exacerbate antibodies by, I think it's 70%. Iodine has been shown to blow up. Gluten has been shown to blow up antibodies. And there's a number of other things, but these ones have been researched pretty thoroughly. So if you take those, you go get, and they've blown up your antibodies, but they haven't given you symptoms, and you go and get your test, you're going to be shocked that your antibodies are way up, and you're feeling good because maybe you've been taking really good care of yourself. You've been sleeping, you haven't been eating junk, you haven't been eating gluten, all those types of stuff. So it's a balancing act. So I don't think they actually go into remission. Now, I'm not an autoimmunologist, okay, but I read a lot on this, and I don't think they ever go into remission. I think they can go down. I think they can go up. But another mistake, and I think a reason for this question, is the confusion of doctors saying, "Oh my God, your antibodies are way up," and so then they treat you, and you're feeling a lot better, and then you come back, and your antibodies are the same or worse. And then you feel like, oh my God, I'm not getting better. The antibodies really are not a good measure as to whether you're getting better or not, frankly. So the whole idea of can the antibodies go into remission is really probably not the proper way to look at your case. To determine whether you've gone in remission, you're gonna look more at, has my rheumatoid arthritis stopped hurting? Is the swelling gone down? Am I not getting anxiety anymore? Am I not getting heart palpitations anymore? Has my hair started to grow again? Has my bowel problems gone away? That's remission. It means that those areas of your physiology are not being attacked anymore, no matter what your antibody count is, and that they're not being attacked anymore, and that the damage that has been created at that point in time has stopped. Possibly some healing in those areas is taking place. And now you're in remission, meaning you're waiting for the next trigger to blow you up. But using antibody measurements to make that determination, in my experience, is almost no correlation. The only correlation to me, my understanding of it, is if you have positive antibodies, we know that your DNA has told your immune system that it's okay to now attack that specific tissue in your body. And it may never attack it to the point where you actually get symptoms, or then it ultimately will start attacking to where you get symptoms. And then it becomes very complex. You have to start digging for these, triggers. And then you find the triggers, you get them under control, symptoms go away. That's remission. And so do antibodies go in remission? I actually think it's a moot question, but I would say that I think the answer would probably be no, that they probably. Well, again, the definition of remission relative is usually not used relative to antibodies. It's usually used relative to your symptoms going into remission. So I think that's the better answer.